Hey guys, it's a North Sleeve out for a little ride today. If you're interested in finding out what the process is of having a vertical gastric sleeve bypass surgery, or VSG as everyone else calls it, or as it's known, VSG surgery, stay tuned and we'll be right back. Alright guys, I'm back. Just letting you know, when I started my process, it was beginning of August, I believe, or at the very end of July of 2017. I had my surgery on April 20th, 2018. So that was what, 8 or 9 months of going through the process to have the surgery. My health insurance through my employer covered it 100% as far as I'm aware of. That's what they told me it would be. I have not received a bill as of yet. It's what, a little bit about almost close to 5 weeks after surgery already, so I haven't received anything, which doesn't mean that I still won't. But that's what I was told, so that's why I went forward with the process. I tried to get the process done, I don't know, probably 8, 9, 10 years ago, maybe even. Went through some classes, met with a doctor and all that stuff back then, but my insurance at that time would not cover it. So of course I didn't have that surgery back then, and you know, I wish I could have. I wasn't able to afford it out of my own pocket, which I don't think many of you can. Most people can't, so I had to put it off. But anyways, so my current employer, who I'm with now, my insurance covers it, so I went ahead with it. So like I said, I went in there for my first appointment at the very end of July, let's just say August, the very first part of August of 2017. I had to go through a series of different appointments with some nurses, dietitians, physical therapists, and a psychologist. I must have met with the dietitian prior to my surgery at least 3, or I believe it was 3 times, but it might have been 4 times. I met with a physical therapist on 2 or 3 occasions. And what they need you to do there is they just want to put you through a little bit of strenuous testing. They take some heart rates or blood pressure, you know, before, after, and during your trial or your workouts, to see how your heart's reacting and all that kind of stuff, which I think is actually good, because they don't want you, you know, throw you up on that table and have your heart give out. And I went through pretty much all that with, I guess, flying colors. My therapist said I did real well and I didn't have any issues. I did have some issues in a couple of things I did, because I have a well, I've had my left hip replaced 3 years ago. I have a titanium hip in my left leg, and my right hip is totally shot right now. I'm bone on bone, and I have a really hard time moving. So any lateral movement, you know, on a stationary bicycle or a regular bicycle or anything like that, I really can't do very well. And it's one of the reasons why I chose to get this surgery. But anyways, so I had some issues during the physical therapy, but the rest of it I could do. So able to get my heart rate up, and they could test it and all that kind of stuff. So you like I said, you have to go through all of that. You have to meet with a psychologist, who I met with one time. I believe it was an hour, 45 minutes to an hour session. Ask you a bunch of ridiculous questions. I'm sure they charge your medical company, you know, $300, $400, $500 for that hour, which is, you know, basically going to talk to somebody for an hour. That they ask you a bunch of ridiculous questions and you answer them that a monkey could answer. It's really, to me, it doesn't make any sense to have to go through that. I understand the process. The psychologist is there to see if your mindset's in it and you're going to do well. Well, I mean, most people that choose to do this are going to do well. I don't know how they could really tell that you can't, unless you really went in there and you were really off your rocker or something. I don't really know. But anyways, to me that was kind of foolish, but I understand the process. I went through it, I did it. meeting with the dietitians prior to your surgery is actually a good thing now. I realize back then when I was going through it, I could care less. It made no sense. At the time, my mindset was I was going to have this surgery and I was going to do whatever it was that needed to be done to be successful at it. Now, of course, during that process, they want you to lose a bunch of weight before the surgery, which I tried to do, and to be honest with you, I never did. They want you to get down to, eating the healthier foods, not drinking while you're eating, and all that kind of stuff, which is actually a very strong part of the process, because once you have the surgery, you need to follow those guidelines to a T so that your system works well. If you follow it to a T, like I have so far, pretty close, I'd say 95% or a little bit more, I've followed everything. You'll heal good, you'll feel good, your surgery will go great, all that kind of stuff, which mine has. But anyways, the dietitians, they tell you certain things to eat, foods you should stay away from. They try to get you on a meal plan, want you to lose weight. I think it's great. I wish I would have listened to them more during that process, because I probably could have lost, 30 to 40 pounds or 50 pounds in that 8 to 9 months or whatever it took to get the surgery, which I never did. Again, if you're just starting this process and you meet with these people, listen to them and follow their guidelines. You're going to do what you're going to do on your own anyway, but the dietitian part of it, I would follow, because number one of the big concerns before you have the surgery is your liver size. Your liver is big, like right now when you're obese. And when you lose a bunch of weight prior to surgery, like 20 pounds, like 15 to 30 or more pounds, your liver shrinks, loses its fat. And it helps the doctor in the process of operating on you when they do the laparoscopic surgery to use the tools. They have a tool that holds your liver up, because your stomach is located underneath your liver. They have to hold your liver up to get at your stomach. So it helps them in the process of the surgery when your liver is smaller. So I understand them pushing the losing weight part of it during your pre-op surgery process. Now, I'm getting a little ahead of myself here, but I never lost any weight really up until my pre-op diet started with the liquid diets and the protein shakes, in which I lost 21 pounds in 12 days, which I thought was great. And I would assume my liver shrunk, because I've had no issues at all since my surgery, and everything went great. Now, getting back to where I was. If you're doing this, try to stay on track with the dietitians, because it will help your body succeed in the surgery as well as your mind. Getting to the mind part of it. The mind part of this whole surgery is the liver part of it for the pre-op diet or whatnot. I think is obviously a huge part, and it helps. I think they can do the surgery even if your liver is normal size. I don't believe that for a second that they can't, but I'll leave that to the experts. I'm no expert, I'm no doctor. I think the major part of it, probably 70% of the whole process, is psychological. You need to have the right mindset to go into this. You need to be able to have the willpower and decide that you can do this. And if you don't, I don't think you're going to succeed at it. I wasn't sure if I was going to. During this whole process, I had mixed emotions. Certain days I would be like, yeah, I'm going to have the surgery. Certain days I was going to be like, there's no way I'm having the surgery. I'm not having half my stomach cut out, or actually 3/4 of your stomach cut out, and not going to be able to eat certain foods, blah, 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 blah. I like to eat. And I got to thinking, after every time I would think of that to myself, it's like, you like to eat. For all these years, you've ate every day like a pig. You don't get to be obese the size I was, 6'2", 354 pounds, from not eating. And eating crap food is all I ever ate. So I told myself, well, there's really no reason for you not to do this. You have some other health issues, and you need to save your health, save your life, add a few years to your life by having this surgery. So I said, okay, I'll do it, and I did it. We gotta take a little break here, guys. I arrived at my store. I didn't think I'd be here that fast, so I'll come back and we'll finish this in a few minutes.